Hey everyone and welcome back to my channel Physio Trends. Last video I gave you all assessment format for Akhil about the back pain and we explained everything that what is his status, what are tests are positive, what all observations were made in the posture assessment, gait assessment, everything. And then I told that next video I'll come up with the treatment protocol and that is what this video is about. So let's just go back and brief out what all findings were there in the last video about according to the assessment of the patient. So we found out that SLR test was positive, slump test was positive, and also when we checked for the L4, L5 nerve root myotomes, they were also showing weakness, which means it confirms that definitely L4, L5 nerve root compression is present. So that is our first diagnosis. Second thing, we found out that during the posture assessment there was an anterior pelvic tilt, there was increase in lumbar lordosis, which means definitely there is a lower cross syndrome present, which means there is a tightness of hip flexors and lower back muscles and weakness of lower abdominals and gluteus maximus muscle. So that is our second diagnosis. And the third important diagnosis what we found in the assessment was there was a weakness of hip abductor muscle, because we saw that trending bug sign. It was not completely positive, but we found some weakness in the hip abductor muscle. So we are going to plan our treatment now on the basis of these three diagnoses. We are going to cover all these points and treat them symptomatically as well as from the root cause. So for the first part of the treatment, we have chosen to give intermittent lumbar traction. Why? Because patient has lumbar spine radiculopathy. We have noticed that there is a myotomal weakness, and that is why we can give this intermittent lumbar traction. As you can see, I have positioned the patient in such a way with a 90-degree hip flexion, 90-degree knee flexion. Now you could ask that why can't we give this intermittent lumbar traction without knee or hip flexion? So for that we have to understand the biomechanics of spine, guys. What happens that if you are keeping it completely straight and you are pulling it from the one direction, the more force is acting over the upward spine. It is like somewhere around the L1, L2 level. But if you want to give more traction to the L4, L5 level, then you have to flex the hip and knee joint maximum, which is around 90 degrees. If you want to give for L2, L3, you can flex it for 30 degrees. If you want to give for L3, L4, you can flex it for 60 degrees. And here, because we want to concentrate more on the L4, L5 segment, I have kept it for 90-degree flexion at the hip and 90-degree flexion at the knee joint. And for the same, I have kept the parameters according to patient's weight. We found out that patient's weight is somewhere around 75 kg, and for lumbar traction we give weight divided by 3, which will come around 25. But just because it is acute stage, we are giving the traction weight up to 20 kg. We are holding it for 20 seconds and rest time for 5 seconds. And that will be given for 12 to 15 minutes of intermittent traction. One more thing to notice is, my dear friends, don't forget to unlock the table from the downside. You must have noticed that there is a lock below the table just to separate the table for pulling better way. So that you have to make sure that you have to check it before giving the traction. So this will be our first mode of treatment for this patient. So for the second part of the treatment, we are going to perform nerve mobilization from the distal as well as proximal end. So for the distal end, first of all, patient's position is going to be just same like slump test. We ask patient to be in high sitting position. Then we ask patient to perform the same side which is affected. In this case, it was right side. So we ask patient to perform knee extension. For distal part, we ask patient to perform dorsiflexion at the ankle. Along with that, we have to go for neck extension. So that will be for the lengthening of the nerve from the distal part. Along with that, now we ask patient to go for neck flexion, and there will be plantar flexion at the ankle. So we ask patient to perform that. Now let's observe how the patient is performing simultaneously. First thing is knee extension. You have to go for ankle upward movement and neck upward movement. Now you have to go for ankle downward movement and neck also downward movement. So here we can observe that when patient is performing dorsiflexion and neck extension, that time we are lengthening the nerve from the distal part. And when the patient is going for neck flexion and plantar flexion, we are stretching the nerve from the proximal part. So this can be very effective treatment for the patient in cases whenever the nerve root compression is present. Now for the third part of the treatment, we make patient lying in the crook-lying position. Why? Because we have observed there is an anterior pelvic tilt. And to correct this crook-lying position can be a best position for the patient, because in this, the pelvis goes in the posterior direction. Plus, now we are going to ask patient to activate the lower abdominal muscle. There will be isometric contraction of lower abdominal muscle. In this, what we have to make sure is that patient is keeping on breathing normally along with the contraction of the lower abdominal muscle. So for that, what you can do is you can ask patient to count while the patient is holding the lower abdominal muscle, so that we make sure that patient is not holding the breath. So now you have to just concentrate on this muscle. So you have to try to contract this muscle and count till 1 to 10. Okay, contract the muscles. Yes, now count 1,
2,
3.
4, 5, 6, 7, 8, 9, 10.
Yes. So initially it might be difficult for the patient to concentrate and activate the muscles. So you have to keep your hand or fingers so that we come to know that whether patient is contracting the muscles or not. And also along with that, we ask patient to call out the numbers. So that is just to make sure that patient is not holding the breath.